Hi, I'm Elliott Danker from Power 98, and joining me today is Dr. Carolyn Lam, a consultant at the National University Heart Centre, Singapore, as well as Associate Professor at NUS Yong Lin School of Medicine. Welcome. We're talking about blood pressure, of course, and every time we go to a doctor, when they start taking our blood pressure, they never actually say it out, but what's the reading that I need to take note of to be worried about it?
Good question. So for you and I, young people,
yes,
okay,
very young that way.
All right, and who have no other medical issues, actually a normal blood pressure should be less than 120 for the top number,
Okay.
and 80 for the bottom number. The units of these are millimeters mercury.
Okay.
The top number is the so-called systolic blood pressure, and the bottom is diastolic blood pressure. You say you're safe, but I seem to remember taking your blood pressure one day and realizing that you have this thing that we call a white coat high blood pressure.
Interesting story. I actually suffered from thyroid disease for about 2 years, and towards the end of it, as I was recovering, I had a case of high blood pressure, which is about 140. So it's not quite high, but it's danger zone. Took a while for me to bring it down. Then after that, every time I went back to the doctor, I used to get scared. I used to get worried. So the initial reading would go up to about 140, but very quickly would drop. 117, 120, 125 was the highest I got. And I think that has something to do with stress as well, right?
Very, very good point again. So I just told you 120 over 80 was normal, healthy young people, okay? But to make the diagnosis of high blood pressure, the numbers are slightly different.
Okay.
Is above 140 over 90. So you're absolutely right that the top number 140 is what they said, maybe borderline. What you have is what many of my patients have, unfortunately. I don't wear a white coat, but it's supposed to signify the idea that patients come into a hospital setting and blood pressure goes up. It's like a stress response, and it is quite normal. The other thing that makes your blood pressure go up normally is when you exercise. And this is important for us. When we exercise, the top number should go up and the bottom number should go down. And that's because we need a greater circulation. So it's true that blood pressure, don't be scared. If you measure it minute after minute and it goes a little bit like this, that's normal, okay? It's normal for our blood pressure to be a bit different. And it is true that to make a diagnosis, we sometimes have to repeat, not just repeat it on the same arm, but different arm, and it has to be taken when a patient is sitting, legs are not crossed, you're not eating, you're not talking, quietly for at least 2 minutes, and then you take. Now that is the blood pressure that we're talking about to make the diagnosis.
To keep quiet for 2 minutes is hard for me.
I know.
But speaking of stress, if let's say I led a healthy life, I exercise right, I eat right, but I'm always stressed and worked up at work, can I still get high blood pressure?
Yes. So some of the independent causes of high blood pressure include too much stress.
Okay.
So that's one. And when I say independent cause, that means when you equalize for all other things. But other things that are within your control are your weight, the amount of sodium, salt that you take, smoking, alcohol, exercise. So exercise can actually lower one's blood pressure in the long term as well. So inactivity is also another cause of high blood pressure.
Okay, so I've got high blood pressure now, let's say. So what? I'm on the pill for life, is that it?
Okay. This one I get a lot from my patients. When I tell them that yes, we need to control it, they feel like it's a death sentence. You know, and a lot of them either don't want to know the diagnosis or they try and bargain with me.
Okay.
But what we need to understand is if I told you you had diabetes, you know that you must control it. Nothing you can do or wish or pretend is going to let the diabetes go away. Another important message is you can have the diabetes or the high blood pressure and you will feel fine until you get the complication, which is a heart attack or a stroke. And why do you want to wait for that? So it's not as if we are purposely saying you have high blood pressure and therefore condemning you to a lifetime of medications. It's that when we find it, we want to prevent the complications. So how do we treat it? We have to take medications.
And let's say, unfortunately, I already have high blood pressure.
Yeah.
I know that these complications could happen. What are some everyday things that we can do to sort of prevent it or control it?
Okay, so beyond medications, you mean? So if you have high blood pressure, must see a doctor and see if you need medications, okay? But the other things that you can do for yourself are actually the opposite of the risk factors for high blood pressure, right? So if you're overweight, you must lose weight. Yeah, that alone can sometimes get obese patients off medications.
Okay.
Stop smoking.
Okay.
Alcohol intake must be limited. And then there is this very special diet called the DASH diet. Stands for Dietary Approaches to Stop Hypertension. Okay, it's a long, complicated thing. Let me simplify it, okay? Number one, low sodium.
Okay.
Low salt.
That's the salt.
Okay. Number two, high potassium.
Oh, bananas.
More than that.
Okay.
Bananas, oranges, tomatoes, other things.
Okay.
So you take more potassium. And then the third thing that they advocate is actually non-fat dairy. A little bit difficult for us in this setting, you know, where we have a lot of lactose intolerance.
Yeah.
So the things to remember for us Asians especially is low salt. Okay, we have more salt in our diet than we even think. Yeah. For example, I bet you if I asked you what you ate today, you would not be able to pinpoint where the sodium came from.
I ate an egg mayo sandwich.
Hi-yo! Okay, that's full of salt and cholesterol. Luckily, you're young.
You always make me feel good about myself. Thank you.
So you'd be surprised, you know, even bread has salt.
Okay.
I mean, I'm not saying that you need, that's the highest salt intake. But a lot of people, oh, I'm not putting the white crystalline salt. I just put a lot of cho cheng.
It's the same thing.
It is salt. It's because it's sodium. And a lot of people don't realize, you know, when you have your rice, your zhi cha, and then you put the curry is the thing that's full of salt. And you cannot taste it, you see. So those are the dangerous little things.
What about low blood pressure? I mean, we talk so much about high blood pressure. What are the effects of low blood pressure?
I get that question a lot. So low blood pressure tends to occur especially in us young, slim females. Yeah. And okay, so the point is that it's considered low officially when the top number is less than 100.
Oh, wow.
But really, if you are thin and young, especially if the arm is very skinny, it's very likely that you can get a number near 100, maybe something, 100 and something.
Okay.
Now, the important thing is that that person is not feeling faint.
Okay.
Because it's good to have a low blood pressure. Athletes, for example, will have a slow heart rate and a low blood pressure. You see, but you cannot be feeling faint. If you're feeling faint, then that's not a normal low. That's not enough to get to your head.
It's not enough blood going.
Exactly.
Last question, and this has always got me curious. My mother is a high blood pressure patient, and you know we hear about hereditary high blood pressure, right? Does that mean that I will get high blood pressure one day?
Fortunately or unfortunately, the most common type of high blood pressure is called essential hypertension.
Okay.
When you hear us doctors say essential or idiopathic, it's just fancy words to say we don't know why. Okay, and a lot of that has a family history.
Okay.
Now, in your mom's generation, like in my parents though, they have a lot of other risk factors.
Yeah.
You know, they may not have been as healthy and eaten as healthy, have as much healthy choices in food as we do now.
Okay.
So never feel that I've got a family history, there's nothing I can do. That's not true. So you have to understand and accept that you're at increased risk, that's a fact. But there's plenty you can do, so don't get overweight, don't go and compound it by smoking. Make sure you take care of your diet, and many can stay healthy.
Great.
And exercise.
That is excellent news.
Yeah.
Well, thank you very much for your time. And make sure you join me for the next session as I speak to another guest. We talk about breast cancer.
Love life, love music.
Power 98.